Today we will discuss about the anticholinergic action, especially the anticholinergic drugs. It's auto showing. So there is a problem. Okay. So the stream. Anticholinergic drugs and drugs acting on the autonomic ganglia we are going to learn today. That's the anticholinergic drugs are also known as the muscarinic receptor antagonists or also atropinic, or also they can also be called as the parasympatholytic drugs, means which lysis of parasympathetic system, or mimetic means they are going to mimic the parasympathetic system. So these are parasympatholytic systems, and the term adrenergic drugs is restricted to those which block actions of acetylcholine and autonomic effects and in the CNS exerted through muscarinic receptors. Usually anticholinergic drugs are referring to the muscarinic receptor M1 to M5, whereas the nicotinic receptor antagonists also block certain actions of the acetylcholine, and they are generally referred as the ganglionic blockers or neuromuscular blockers. So the ones which act on M1 to M5 type of the receptors are called as the anticholinergic, and this the drugs which are acting on NN and NM are known as the ganglionic blockers or the neuromuscular blockers. And the atropine is the prototype, means the universal drug for the category example, and is highly selective for muscarinic receptors. But some of its synthetic substitutes do possess significant nicotinic blocking property. So the atropine sulfate or atropine is very, very specific for blocking muscarinic receptor, but not on the nicotinic receptor. But its congeners are also acting on the nicotinic receptors. So all cholinergics are competitive antagonists, means as the concentration of the agonist is increasing, the effect of the antagonist is reversed, let's say in a competitive manner. And the classification of these drugs are like this. So the first one is the natural alkaloids obtained from the plants, just like the atropine, and another thing is the hyoscine. Both are, it's also known as scopolamine. Hyoscine is also known as scopolamine. And second one is the semi-synthetic derivatives. So these are hometropine, atropine methone nitrate, then hyoscine butyl bromide, ipratropium bromide, and tiotropium bromide. So these are semi-synthetic derivatives. Whereas the totally synthetic compounds are the mydriatics, means which cause the pupillary dilatation, just like the example is cyclopentolate and propicamide. Both of these are the examples. Whereas the anti-secretory agents or antispasmodics, or which reduce the spasm of the intestine, are called as the antispasmodic drugs. Once again, they are classified into two categories. One is quaternary compounds and another one is the tertiary amines. So quaternary compounds are propanthelin, oxypenonium, glidinium, and also the few of the drugs like pipenzolate methyl bromide, isopropamide, glycopyrrolate. So these are the example. So you can remember these drugs. And tertiary amines are the dicyclamine and velethamate, bromide and pyrenzepine. These are all the tertiary amines. So the classification: natural alkaloids, semi-synthetic derivatives, synthetic, and under synthetic, once again the quaternary ammonium compounds and the tertiary amines. And some of the drugs are especially vasoselective, very specifically used for the vascular system, like oxybutynin, flavoxylase, and tolterodine. So all these are vasoselective. And anti-Parkinson disease or anti-Parkinsonian drugs. These drugs are like trihexyphenidyl, it's also known as benzohexol, and proquilamide, procridine, or the biperidine. The trade names are also available for this anti-Parkinson disease. And most of the natural alkaloids are found in the plants, the Solanaceae family. Solanaceae is a very huge family of the plants, and most of the Solanaceae do contain the atropine in their fruits. The levoisomers are more active than the dextroisomers. The chemistry: atropine is a racemic, while scopolamine is L-hyoscine. So this is the chemical structure in very brief. Then pharmacological action of this atropine is what you call as, it's a prototypic drugs, means it's a means unique example for the category. So let us know what are all the effect of this prototypic drug on the different systems of the body. So the prominent effects are seen in organs which are normally receive a strong parasympathetic tone. Wherever parasympathetic tone is there, apart from the nicotinic type of the receptors, atropine is going to act. So atropine blocks all subtypes of the muscarinic receptors starting from M1 to M type. So it's available as the atropine sulfate injection, whereas this 8 milligram per 20 ml injection is there, or else 0.5 milligram per 0.4 milligram per ml. So it's for the use like intravenous, intramuscular, subcutaneous, and many other routes are also there. So 20 ml multi-dose vials are there. Many companies are producing the particular injection. And the natural source of this atropine is found in many members of the Solanaceae family. As it is already told, the most commonly found source are the Atropa belladonna, which is also known as deadly nightshade, and the Datura inoxia, Datura metal, and Datura stramonium. All these are the sources of the atropine and congeners. Whereas other sources include the members of that's Brugmansia family and Hyoscyamus genera. So this is in the right side, you can see the berry of Atropa belladonna. Here also you can see, and this is the flower. And you can see this is a plant, Atropa belladonna, and also it's known as the deadly nightshade, because after consuming the berry of this plant or the fruit of this plant, there is blindness. So it is known as the deadly nightshade because of this particular property. And also the fruits are very attractive for the animal to eat, and many times the sheep succumb to the poisoning of the Solanaceae family plants. Many type of the plants are there, and you can see here the flower, very attractive flowers are there, and by eating the fruit, the toxicity is very high. And the effect of atropine on the CNS is it's a stimulant action, of course, stimulant action, whereas the atropine does not cross blood-brain barrier in low doses, whereas in high doses it is going to cross the blood-brain barrier. And the hyoscine produces central effects, especially different even at low doses. So it's going to pass through the blood-brain barrier. And atropine stimulates many medullary centers, especially vagal, respiratory, and vasomotor centers in very high doses. Normal and very low doses, it's not going to do. Whereas in high doses, it is going to cause all these particular signs, and it depresses the vestibular excitation and has anti-motion sickness property. So this motion sickness is a very common problem in many of the individuals. Whenever they are traveling in the car, they get the vomission, and the site of action is not clearly or probably not understood, but there may be a cholinergic link in the vestibular pathway, or it may be exerted at the cortical level in little bit high doses. And by blocking the relative cholinergic overactivity in basal ganglia, it suppresses tremor and rigidity, especially in case of Parkinsonism. But atropine is not used as a drug of specific choice in case of the Parkinsonism, because it is not specifically acting wherever it is needed. And here you can see that the motion sickness, while a person is traveling in a bus or car, he may vomit. So, especially in AC buses, they are giving a special bag for vomition, and this is known as the motion sickness. So, to avoid the motion sickness, the atropine and its congeners are administered. And of course, the motion sickness, especially, or the sea sickness, it's also known as, and in this situation, the vestibular apparatus in the auditory nerve, then it is affected. Hence, the motion sickness occurs, and many times the drugs like the hyoscine and then the atropa and its derivatives like propanthelin and many drugs are used to treat the motion sickness. Yes, of course, the motion sickness is one of the common problem, because the in the higher centers in the brain are affected and going to cause the omission, severe omission, or sometimes dizziness, giddiness, so many other things are there. So high doses cause cortical excitation, especially if you administer atropine, high doses, restlessness, disorientation, hallucination, and the delirium, because if you administer the atropine sulfate in higher doses, then it's going to cause all this type of the central nervous system activity. So majority of the central actions are due to the blockade of muscarinic receptor in brain, but some actions may have a different basis also, little bit complicated action. On the cardiovascular system, on the heart, so the most prominent effect of atropine on the heart is tachycardia, because it is due to the blockade of M2 type of the receptor on different sides of the heart, maybe including SA node, and also which vagal tone decreases the heart rate. And higher the existing vagal tone, or which leading to more marked in the tachycardia, especially maximum in young adults, and especially it is less in the elderly. On IM or subcutaneous injection, transient initial bradycardia is often seen, and the earlier it is believed due to the stimulation of vagal center, especially in the brain, and it is now thought to be caused by blockade of the muscarinic autoreceptor on vagal nerve endings, thereby augmenting acetylcholine release. So these actions, especially on the heart, are interrelated to one and another. The blood pressure, why I am dealing in detail about the atropine is, it's a very, very commonly used agent in veterinary practice and also in the human practice. So atropine, of course, many times it is overdosed and many times the toxicity occurs. So what are all the things, the changes that happen in the body need to be learned by the persons who learn the cholinergic nervous system. And on the blood pressure, cholinergic impulses are not involved in maintenance of vascular tone. Atropine does not have any consistent marked effect on blood pressure, because to increase the blood pressure, simply in what you call as the increasing the heart rate or the force of contraction is not sufficient. There should be constriction of the peripheral vasculature also. So atropine is not doing the second one. So even though the heart rate and the force of the contraction are increased to some extent, there is no rise in the BP. Tachycardia and vasomotor center stimulations tend to raise blood pressure, while histamine release and direct vasodilator action tend to lower the blood pressure. And atropine blocks vasodepressor action of the cholinergic agonists. That's it, one of the important action of the atropine sulfate or atropine. And here you can see the effect of the atropine on eye. So here the autonomic control of iris muscle and action of the mydriasis as well as the mitotic is illustrated on the left side figure. And in the normally in case of the normal, acetylcholine is going to act on the circular smooth muscles or the dilator pupillae. The muscles are the dilator pupillae and short ciliary nerve. It's going to act on the ciliary ganglion, and long ciliary nerve, it's sympathetic in nature, and also the sphincter pupillae. And this is the iris. So iris, whether it's one thing, the dilator muscles are the one which are going to have this pupillary dilatory action. Whereas the autonomic control of A is autonomic control. Both sympathetic and parasympathetic nerves are there. So the parasympathetic nerve is going to have the opposite action from the sympathetic stimulation. And the site of the action of mydriatics and mitotic. Here the circular muscles, especially relaxation of sphincter pupillae. So the antimuscular or ganglionic blockade. Whereas the contraction of the dilator pupillae is caused by alpha-1 adrenergic agonists. So totally, whether it causes the dilatation or constriction of the pupil, it depends upon the dominant action of each system. Whereas the what you call as the autonomic control of pupil, action of the mydriatic action, and the mitotic action is caused by the contraction of sphincter muscles under the control of the muscarinic antagonists and anticholinesterase agents, and the relaxation of the dilator pupillae by the alpha adrenergic agonists. So they are going to ultimately cause the meiosis. So mydriasis and meiosis are the opposite thing, and accordingly the drugs can be designed as the what you call as the mydriatic or mitotic action is required. Then many times this atropine and the derivatives are used as the topical agents. Many times they are used as the topical agents. Then the thing is, once you have, this is, please remember, this is very important, the action of the atropine. Topical installation of the atropine causes mydriasis, that means the pupillary dilatation, and abolition of light reflex and cyclophagia lasting for 7 to 10 days. Please see here, whenever the atropine is instilled on the pupil, then the person should not go in the bright light, because the pupillary dilatation will long last for about 7 to 10 days. And this results in photophobia and blurring up of the nearing vision, because the pupillary dilatation causes blurring up of the near vision. and the ciliary muscles recover somewhat earlier than the sphincter pupillae. The intraocular tension tends to rise, especially in case of the glaucoma. Glaucoma, it's always going to have the adverse effect, especially if you use the atropine sulfate. And the smooth muscles, like all visceral smooth muscles that receive parasympathetic motor innervation, are relaxed by atropine because they have the M3 type of the receptor. And tone and amplitude of the contractions of stomach and intestine are reduced. The passage of chyme is slowed. Yeah, this is another very what you call as exaggerated side effect of the atropine. That's the severe constipation may occur and the spasm may be relieved. And however, peristalsis is incompletely suppressed because it is primarily regulated by the local reflexes in the enteric plexus and other neurotransmitters like 5-HT, enkephalins, and sometimes the noradrenaline also. So, the complete suppression of the peristalsis cannot happen, but in the higher doses this may happen. And atropine causes the bronchodilation, and especially it is useful especially on the COPD and asthma patient. So what you call as the reduces airway resistance and the COPD and asthma patients. And inflammatory mediators like histamine, prostaglandins, leukotrienes, kinins, they participate in asthma, increase vagal activity in addition to the other direct stimulant actions. Direct stimulant actions. Then many times the action is atropine attenuates their action by antagonizing the vagal component, and atropine has relaxant action on ureter and urinary bladder. Urinary retention can occur in old males with prostatic hypertrophy if you administer the atropine sulfate. However, the relaxation effect can be beneficial for increasing bladder capacity and controlling detrusor hyperreflexia in neurogenic bladder or anuresis, neurogenic bladder. Especially in diabetic patients, this is going to happen. Neurogenic bladder means the person has lost the control over the bladder. And the relaxation of biliary tract is less marked and effect on uterus is minimal. And the glands. The atropine markedly decreases sweat, salivary, tracheobronchial and lacrimal secretion through M3 type of the receptors. So all the glands do have what you call as the anti-secretory action, and skins and eye become very dry. Then talking and swallowing may be very difficult in case of the atropine overdose. And atropine decreases secretion of acid, pepsin and mucus in the stomach. But the relatively higher doses are needed, and atropine is less effective than H2 blockers in reducing the secretion. And the intestinal and pancreatic secretions are not significantly reduced. And also the bile production is not under cholinergic control, and it is not affected because it is under the control of adrenergic nervous system. And the body temperature, so there is increase in the body temperature occurs at higher doses of the atropine or atropine-like toxicities, and this is due to both inhibition of sweating as well as stimulation of temperature regulating centers in the hypothalamus of the brain. And children are highly susceptible to atropine fever. So atropine fever is occurring in case of the overdose of the atropine or the atropine toxicity. And the local anesthetic effect is also attributed to atropine, and it has got the mild anesthetic action on the cornea, but it cannot be used as a main substance, the main drug. Atropine is found to enhance acetylcholine and also norepinephrine from certain postganglionic parasympathetic and sympathetic nerve endings, and thus produce the paradoxical response. Paradoxical response. So what's a paradoxical fear? When there is no escape route or no way to win, that causes massive activation of the parasympathetic division and loss of control over urination and defecation occurs. And because of this thing, you might have seen that many animals, when they are under fear, they are going to have the defecation more and more and the urination, which is mediated by both sympathetic and parasympathetic nervous system activation. And then another terminology is there, that's the atropine fever. This especially occurs in children or in case of the young animals, because here what happens is the atropine sulfate is going to block all the receptor, especially the secretory receptors, and what you call thermoregulatory and sweating is also decreased. That's why the body temperature is going to rise in atropine poisoning. So this is known as the atropine fever, especially in case of children, and the entire face become reddened and blushing happens. That is known as the atropine fever. Whereas the sweat glands, also here you can see that atropine, especially in case of flushed, in case of dry skin occurs, so heat evaporative capacity is going to decrease, and increased blood flow for increasing heat dissipation occurs. Hence, the body temperature is markedly increased, which leads to the atropine fever. And the sensitivity of different organs and tissues to atropine varies and can be graded as the saliva, sweat and bronchial secretions are very much exaggerated when compared to eye, bronchial muscle and heart, which are more sensitive than smooth muscles of the intestine and bladder, and comparatively these are more sensitive when compared to gastric glands and gastric smooth muscles. And the above differences probably reflect the relative dependence of the functions on cholinergic tone or vis-a-vis other influences and variation in synaptic gaps in different organs. So the synaptic gaps or the ganglionic gap may be synaptic cleft. This has got difference in the different innervations. The pattern of relative activity is same for atropine substitutes except pyrazine, which inhibits gastric secretion at doses that have little effect or the secretions. Of course, the atropine equally blocks M1 to M3 receptors, whereas the pyrazine is a selective M1 antagonist. So, the M1 type of the receptors are present on the gastric parietal cell, and with the action of acetylcholine on it or the parasympathomimetic symptoms, acid is being secreted, whereas this can be effectively blocked by either atropine or pyrazine. Atropine is non-selective for 3 receptors, whereas the pyrazine is selective for M1 receptors. Atropine is more effectively blocks the response to exogenously administered cholinergic drugs than those of the parasympathetic nervous system, and this may be due to the release of acetylcholine very close to receptors by nerves, and that's the involvement of the co-transmitters. Especially the hyoscine, the natural anticholinergic alkaloids differ from the atropine in many respects, especially in that is tabulated in the future slides. Coming to the pharmacokinetic property of the atropine, please remember that atropine and hyoscine are rapidly absorbed from the GIT, whereas applied to eyes, they are freely penetrating the cornea. Then the passage across blood-brain barrier is somewhat restricted, the atropine and hyoscine, whereas if you use double the dose or triple the dose, then definitely it is going to cross the blood-brain barrier and initiate the central action. The metabolism is 50% of the atropine is metabolized in the liver and rest is excreted unchanged in the urine. And the half-life of atropine is 3 to 4 hours. It's of course it's a short half-life. And hyoscine is more completely metabolized and has better blood-brain barrier penetration when compared to the atropine. The dose of the atropine sulfate is 0.6 to 2 milligram per kg IM or IV, whereas children is very less, 10 microgram per kg. So 1 to 2% solution is applicable as topically in case of the eye. And hyoscine hydrobromide, the dose is 0.3 to 0.5 milligram oral. IM also as transdermal patch can be used. And combination of atropine with other analgesics and antipyretics are banned in government of India because it is causing the many side effects and causing the atropine fever in case of children. Because of these side effects, the combination of atropine with other analgesics and antipyretics are banned in India. And this is a table in which there is a comparative features of atropine and hyoscine are there. And these two drugs are the very prototypic drugs in case of cholinergic antagonists. Source of this atropine sulfate, the very important source is Atropobelladonna and Datura stramonium. Whereas the hyoscine, the chief source is Hyoscyamus niger. Whereas the alkaloid later ester of the tropic with the tropic acid with tropane, they are known as the tropane alkaloids. Whereas the scopine is the base for hyoscine. The central nervous effects at low dose or high dose is the excitation, especially the excitation in case of cerebral nervous system due to the atropine, and low dose mild excitation, high dose the more excitation, whereas it is depression in case of the hyoscine because the hyoscine induces fatigue, drowsiness and rapid eye movement, sleep, normal to rapid eye movement, sleep, and the excitation in very high dose. The anticholinergic property is the atropine is more potent on heart, bronchial muscle and on the intestine, whereas it is more potent on eye and secretory glands, especially the hyoscine. The duration of action of the atropine sulfate is having the long duration, whereas the hyoscine is having shorter duration. The anti-motion sickness property of atropine is less when compared to the hyoscine. So hyoscine is a drug of choice for the motion sickness. And atropine substitutes, there are varieties of the atropine substitutes are there. Then many semi-synthetic derivatives of belladonna alkaloids and a large number of synthetic compounds have been introduced with the aim of producing more selective action on certain functions. So atropine sulfate is the one which is going to block all the type of the receptors starting from the M1 to M5. So many agents like pyrenzapine are developed so that it is going to act on these M1 type of the receptors, or specifically if we want to block say M2, M3 like that, the specific compounds have been developed from the natural alkaloids, but some recent ones are appearing very promising, synthetic also. And a few of them are the quaternary ammonium quaternary compounds, and these have certain common feature like incomplete oral absorption. Most of the quaternary ammonium compounds do have do very less absorption from the site of action, especially in the oral route, and the poor penetration in the brain and eye because of the this quaternary nature. And central and ocular effects are not seen after parenteral or oral administration. And elimination is generally slow. Majority are longer acting than the atropine, and these have higher nicotinic type of the blocking activity, especially the quaternary compounds, whereas the atropine is not having the specific nicotinic blocking activity. And some ganglionic blockade may occur at the clinical doses. And another side effect of these agents is the postural hypotension. The postural hypertension is a type of the hypertension depending upon the posture. If the person lies down, then the blood pressure may be decreased when he is standing. That's known as the postural hypotension. At high doses, some degree neuromuscular blockade may also occur in very high doses. And the drugs in this category are iosine butyl bromide, 20 to 40 milligram per oral, IM subcutaneous IV, and this is less potent and longer acting than the atropine. And this is used for the esophageal and gastrointestinal spastic conditions. It is available in the very popular trade name known as the Buscopan, 10 milligram tablets. The dose is 20 milligram per ml per ampule is available, and you can adjust the dose, just like 20 to 40 milligram. Total dose are oral. And atropine methonitrate, the dose is 2.5 to 10 milligram oral or abdominal, especially in case of severe pain, abdominal colic and hyperacidity. So many these tablets are also available for the oral preparation. And the ipratropium bromide is acts selectively on bronchial muscle without altering the volume of the respiratory secretions. And another desirable feature is that, in contrast to atropine, it does not suppress or depress mucociliary clearance by bronchial epithelium. Then it has a gradual onset and late peak of the bronchodilator effect in comparison to inhaled sympathomimetics. And the dose is 40 to 80 microgram by inhalation route. Please see that the ipratropium bromide is administered only through inhalation route, and action is 4 to 6 hours. The parasympathetic tone is major reversible effect on case of COPD, that's chronic obstructive pulmonary disease. Therefore, ipratropium is more effective in COPD than bronchial asthma. So, in case of COPD, it is very commonly used. And triotropium bromide, of course, this is a newer congener of ipratropium bromide, which binds very tightly to the bronchial M1 and M3 type of the receptors, producing long-lasting bronchodilation, which is required in asthma patients. And binding to M2 type of the receptor is less tight conferring to M1 and M3. That's why it is going to release, acetylcholine is released from vagal nerve endings in lungs due to M2 type of the receptor blockade. And like ipratropium, this is now also not absorbed from the respiratory and GI mucosa and has exhibited high bronchial selectivity in case of the action. Then the few of the other compounds are the propanthelin. So this is a popular anticholinergic drug used for the peptic ulcer and also in case of the gastritis. So it has some ganglionic blocking activity as well and claimed to reduce gastric secretion at doses which produce only mild sedative actions. Total dose is 50 to 30 milligram oral. propanthalin, methanthalin, and all these are used as the antispasmodic drugs, especially in the stomach pain. These drugs can be used. And gastric emptying is delayed and action lasts for 6 to 8 hours. The use of these drugs, especially in case of the gastric acid secretion blocking, is withdrawn due to the H2 blockers and proton pumps, which are very potent and with a very safe the blockers of the proton pump and going to decrease the secretion of the hydrochloric acid and decreasing the acidity. And oxyphenonium, it's 5 to 10 milligram oral, similar to propanthalin, recommended for peptic ulcer and gastrointestinal hypermotility. And another drug known as the clydinium, it is also anti-secretory, anti-spasmodic activity and has been used in combination with benzodiazepines for nervous dyspepsia, gastritis, irritable bowel syndrome, and colic and peptic ulcers. Of course, it's also one of the drugs that can be prescribed. And pipenzolate methyl bromide, it has been promoted especially for flatulent dyspepsia, infantile colic, and abdominal cramps. And isopropamide is used in the dose of 5 milligram total oral, indicated in hyperacidity, nervous dyspepsia, irritable bowel syndrome, etc., and many problems. So this IBS and other things, irritable bowel syndrome, are associated with emotional or the stress disorders. This can occur whenever the person is in stress, the irritable bowel syndrome occurs. And glycopyrrolate is it is a potent and rapidly acting anti-muscarinic agent. So this has, just like atropine, it has low central effects and almost exclusively used for pre-anesthetic medication and during anesthesia, especially as an anti-secreting agent. And tertiary amine, it's one of the important drug. I think many of you might have been prescribed while having the diarrhea, especially the abdominal pain is controlled by dicyclomine hydrochloride. So the dose available is 20 milligram oral, and the children is half. It has got direct smooth muscle relaxant action in addition to weak anticholinergic action. So it has got the weak anticholinergic action, whereas the muscle relaxant action is prominent. The dicyclomine exerts antispasmodic action at doses which produce few atropinic side effects. So the infants have exhibited atropine toxicity symptom, especially in case of dicyclomine overdose, and it is not recommended below the age of 6 months or below. And it also has anti-emetic property and has been used in the morning sickness and motion sickness. So the dysmenorrhea and IBS are some of other indications in which the dicyclomine can be used, whereas the motion sickness is effectively controlled by dicyclomine. It's also known as cyclopam, is the trade name for dicyclomine hydrochloride. And I think many of might have been prescribed with this green colored tablets, especially green colored sachet, which is present in packed like the. And many times dicyclomine is also combined with paracetamol tablets as cyclopam, and this is used for the treatment of abdominal pain, especially in case of the human beings. And morning sickness is also a disease in which there is what you call as vomiting sensation and sometimes the vomition during the morning soon after getting up. So this can also be controlled by the dicyclomine hydrochloride. And valethamate, The primary indication of this agent is the smooth muscle relaxant is to hasten dilatation of the cervix when same is delayed during labor. So this is a very commonly used drug in case of veterinary practice in the name of the valginate and as visceral antispasmodic urinary biliary intestinal chole in this drug can be used. So the dose is 8 milligram IM, 10 milligram oral, repeated as and when it is required. And pyranzapine, yes, this is a very specific M1 receptor antagonist and it blocks selectively the M1 muscarinic receptors and inhibits gastric secretions without producing much typical atropinic actions. Especially the more likely site of action of pyrazapine in the stomach is intramural plexus and ganglionic cells rather than the parietal cells themselves. So this is nearly effective as cimetidine in relieving the peptic ulcers, but nowadays the pyrazapine use is it is abolished because the modern H2 blockers and proton pump inhibitors are there to treat the hyperacidity. And this is the velotamate bromide injection available as the 5 ml ampoule, 10 ml packet, total packing is coming, and sometimes it's 1 ml ampoule also is there with 3 ml in 1 ml. So this is a TTK product and very commonly used to relax the cervical smooth muscles whenever there is a dystocia. And some of the drugs are vesicoselective, means they are very selective for the vascular tissues like oxybutylin. This newer anti-muscarinic has very high affinity for the receptors in the urinary bladder and salivary glands along with additional smooth muscle relaxant and local pre-anesthetic or anesthetic property. So the oxybutylin is selectively for the M1 and M3 type of the receptor, which less action on the M2, especially on the heart. And the another drug known as the tolterodine is selectively M3 receptor antagonist, has preferential action on the urinary bladder and less likely to cause dryness of the mouth and other anticholinergic effect. So very common side effect of anticholinergic effect agents is the dry mouth and the secretion of all the glands will be totally reduced. The tolterodine is indicated in overactive bladder with urinary frequency and urgency. So this tolterodine is also a selective muscarinic antagonist, preferential action on the urinary bladder, less likely to cause dryness of the mouth. So overactive bladder, it's effective, it is metabolized by CYP enzymes and should be halved in the patients receiving the CYP inhibitors like erythromycin and ketoconazole, etc. So the dose is 1 to 2 milligram BD. And flavoxylate has properties similar to oxybutylin and is indicated in urinary frequency, urgency, and dysuria associated with the lower urinary tract infection. So this is very commonly used in case of the urinary tract infection to reduce the pain. So it is nothing to do with the infection itself, but the urinary tract infection causes a lot of pain because of the spasms of the ureter and also the urethra. So the name itself is the urispas. So passing the urine, this can be given. And the derifenacin and solifenacin are relatively M3 subtype selective antimuscarines, especially used in case of the bladder disorders. And rotavirine, a novel non-anticholinergic smooth muscle antispasmodic which acts by inhibiting the phosphodiesterase 4 selective for the smooth muscles, especially the action is non-anticholinergic. Evaluation of intracellular elevation of the intracellular cyclic AMP or GMP attains smooth muscle relaxation, and changes in membrane ionic flux and membrane potential have also been shown. And the drotaverine is used orally as well as parenterally in intestinal, biliary and renal colics whenever there is a lot of pain due to all these things. And also IBS, irritable bowel syndrome, the uterine spasms, etc. The drotaverine is used. And this is not having the anticholinergic side effect. And the drotaverine, mebaverine, etc. are very commonly used in case of the irritable bowel syndrome. So, irritable bowel syndrome occurs when there is a uncontrolled movement of the large intestine occurs or arrhythmic contraction. And the dose of drotaverine is 40 to 80 milligrams, and the trade names are Drotin and Dotarin, and many other trade names are there. And some of the agents are having the pupillary dilatation action, and the atropine is a potent mydriatic, means it is going to cause the dilatation of especially the pupil. So, this drug can be very commonly used in case of such disorders. And the pupil dilates in 30 to 40 minutes, then cyclophagia takes 1 to 3 hours, and the subject is visually handicapped for about a week. See, this is one of the important side effects. The substitutes attempt to overcome these difficulties. And homatropine is 10 times less potent than the atropine. It's instilled in the eye, and especially it causes the mydriasis 1 to 3 days. So often, especially it's ophthalmic use, it is restricted, homatropine. And cyclopentolate is potent, rapidly active mydriasis, and cyclophagia occurs in 30 to 60 minutes, especially last about a day. This is preferred for cyclophagic refraction, but children may show transient behavioral abnormalities due to the absorption of drug after passage into the nasolacrimal duct. So, this also used in iritis and uveitis. Both cases, the cyclopentolate is used. And tropicamide is another drug which has the quickest, that's 20 to 40 minutes, and briefest action, but it's a relatively unreliable cyclophagic drug. And however, it is satisfactory for refraction testing in case of the adults. And the mydriasis many times end up with the mydriasis is end up with the what you call as the photophobia. So that's how the dose need to be maintained very properly. That's why the drugs need to use with lot of caution. And the anti-Parkinson drugs. So Parkinson disease is a condition in which there is involuntary contraction of the appendages, especially in case of the elderly people. So other than this, Alzheimer's disease is the one in which there is loss of memory will be seen, whereas the Parkinson's, there is continuous twitching up of the muscles. And so the anti-Parkinson drugs are used as the anti-secretory drug, pre-anesthetic medication, when irritant general anesthetics, ether, etc. are used, prior administration of anticholinergic like atropine, iosine or glycopyrrolate, and all other drugs are used to increase to check the increase in salivary and tracheobronchial secretions. Whereas the current use of non-irritating anesthetic like halothane, the requirement has been it is decreased. And atropinic drugs also prevent the laryngospasm, not by the action of the laryngeal muscle, which are the skeletal muscles, but by reducing respiratory secretions that reflectively predispose laryngospasm. And the vasovagal attack, including the anesthesia, can also be prevented. And peptic ulcers, of course, the peptic ulcers were treated earlier with that of the anticholinergic drugs, but because nowadays the very specific proton pump inhibitors are there, then now they are slowly being replaced, and atropinic drug decrease gastric secretion, both the fasting and neurogenic phase, but little effect on the gastric phase, and offer symptomatic relief in the people with ulcers, people with peptic ulcers. And though the effective doses always produce side effects, and they have now been totally replaced by the H2 receptor blockers and proton pump inhibitors like pantoprazole, omeprazole, rabiprazole, and the many more agents. And pulmonary embolism, these drugs benefit by reducing pulmonary secretions evoked by the embolism. And also these drugs are used to check excessive sweating or salivation. In certain persons with the Parkinson's disease, all these clinical signs are seen. And pyrospasm, gastric hypomotility, gastritis, and many more disorders can also be used. To relieve urinary frequency and urgency, enuresis in children, oxybutynine, that's the tolterodine, fluoxetine have been demonstrated good efficacy, but the side effects like dry mouth and anti-secretory properties are the limitations. Dysmenorrhea, the drugs are not very effective. NSAIDs are the better for dysmenorrhea. In case of bronchial asthma, asthmatic bronchitis, and chronic obstructive pulmonary disorders, the anticholinergic drugs are also used, with especially the reflex vagal activity is the important factor in causing bronchoconstriction and increased secretion in case of the bronchial obstruction, and also the lesser extent bronchial asthma. And orally administered atropinic drugs are, most of them are the bronchodilators, but less effective than the adrenergic drug. Just like your salbutamol, terbutaline, etc., they are very potent and very specific for the trachea, and they dry up secretion in the respiratory tract and may lead to the inspissation of and plugging up of the bronchioles, resulting in alveolar collapse and predisposition due to the infection. The mucociliary clearance is also impaired, and the inhaled ipratropium bromide has been found to be very specifically effective in asthmatic bronchitis, COPD, though it is less in bronchial asthma. So, especially these drugs nowadays are not commonly used when, as the very specific agent like the beta-2 adrenergic antagonists are used nowadays, and given by the aerosol neither decreases the respiratory secretions nor impairs the mucociliary clearance, and there are few systemic side effects. Thus, it has a place in management of the chronic obstructive pulmonary disorder. So, this is time course action makes it more suitable for regular prophylactic use rather than the control of the acute attacks of the COPD. And the additive bronchodilator action in case of adrenergic drugs is utilized to afford relief in acute exacerbation of the asthma and COPD by administering a combination of nebulized ipratropium, and it is effective and longer lasting alternative to ipratropium bromide. And the anticholinergic drugs are also used as mydriatic and cycloplegic for the diagnostic aspect, especially for testing error of the refraction. Both mydriasis and cycloplegia are needed. So the tropicamide having better action and has now largely replaced the hometropin for this purpose. And these drugs do not cause sufficient cycloplegia, In case of children and are more potent agents like atropine or hyoscine have been used. So atropine ointment is also applied over 24 hours and 2 hours before it is often prepared for children below 5 years. And cyclopentolate drops are alternative to facilitate the fundoscopy. Only mydriasis is needed, fundoscopy. And a short acting antimuscarinic may be used. But the phenylephrine is preferred, especially in the elderly, for the fear of precipitating or aggravating the glaucoma, because most of the anticholinergic drugs are the one which are once again going to increase the intraocular pressure and not indicated. And the combination of phenylephrine plus topicamide drops is frequently used in case of the glaucoma is concerned. And therapeutics uses especially these agents are used as a mydriatic and cyclopasic, especially they are used as the local anodyne or the pain relieving action on the cornea. Atropine is very valuable in the treatment of iritis, iridocyclitis, choroiditis, keratinitis, and corneal ulcer. And atropine gives rest to intraocular muscles and cuts down their painful spasm. And atropinic drugs altered with a miotic prevent adhesions between the iris and lens or iris and cornea, and may even break them if already they are formed. So one need to have lot of careful while administering these particular drugs. And sometimes the clinical use is also a cardiac vagolytic. Atropine is useful for counteracting the sinus bradycardia and the partial heart block in selected patients where there is increased vagal tone is responsible. Otherwise, it is not useful. In case of certain myocardial infarction and digitalis toxicity, it is used. However, cardiac arrhythmias or ischemia may be precipitated in certain cases. So, need to be careful while treating such disorders with the cholinergic receptor antagonists like atropine and the congeners. The central action, especially in case of the Parkinson, so central anticholinergics are less effective than the levodopa. So they are used in mild cases in drug-induced extrapyramidal syndrome and adjuvant to levodopa. Motion sickness, of course, it's one of the common disorder in case of the humans whenever they are traveling and climbing in the ghat section. So there will be severe vomition and dizziness. And the hyoscine is one of the most effective drug for motion sickness. Hyoscine. Please remember this particular drug. If you are traveling in the next times, please keep such tablets, but see although the side effect. And it is particularly valuable in highly susceptible individuals for the vigorous motion. So the drug should be given prophylactically, 0.2 milligram oral, because administration after symptoms have set in less effective, action lasts for 4 to 6 hours, and a transdermal preparation applied behind the pinna 4 hours before the journey has been shown to protect for 3 days. So this is also an important aspect of the therapeutic aspect of the anticholinergic drugs. But the dry mouth and sedation can occur when the driving is risky, because there is a chance that pupillary dilatation, and dicyclomine is another anticholinergic used for the motion sickness, and these drugs are not effective in other type of the vomiting, just like the gastritis vomiting and centrally mediated vomiting are not controlled by the hyoscine or dicyclomine. And hyoscine was used to produce sedation and amnesia, and during the what you call as the labor, or the it's known as the twilight sleep, and to control the menical status. So it has earned a reputation as a lie detector please see that this hyoscine is used in the case of lie detector during the World War II, and its amnesic depression action was believed to put subject off guard in the face of sustained interrogation of especially the prisoners and sleep deprivation, so that come into with the truth, so that the person can come with truth. So this is one of the way of indirectly torturing the patients or the prisoners for telling the truth. And certain drugs to antagonize muscarinic effects of the drugs and poisonous drugs. Atropine is the specific antidote for anticholinesterase and early mushroom poisoning. Already we have dealt this thing. And atropine and glycopyrrolate is also given to block muscarinic actions of neostigmine used for the myasthenia gravis. Please remember Mr. Amitabh Bachchan was suffered from myasthenia gravis, which is a disease in which the antibodies have been developed to the nicotinic type of the receptors in the muscles, skeletal muscles, and decuration or the cobra invasion. And the side effects and toxicity of these agents are quite common with the concomitant administration of especially the anticholinergic drugs. And we can guess what are all the side effects, like the dry mouth, and the belladonna poisoning may occur due to the drug overdose or consumption of the seeds and berries of the datura or belladonna. We have seen several animals are also affected with toxicity. And children are highly susceptible because many times what happens, they are going to eat the berry of the Solanaceae family and do suffer from the atropine poisoning. So the exaggerated pharmacological actions like dry mouth, difficulty in swallowing and talking, and sometimes dry flushed hot skin, especially over face and neck, is also known as the atropine fever, and difficulty in micturition and decreased bowel sounds. A scarlet rash may also appear on the face, and dilated pupil, photophobia, blurring of near vision and palpitation, excitation, psychotic behavior, ataxia, delirium, and dreadful visual hallucinations are seen, especially in case of the humans, and also it's very commonly causing toxicity in case of the sheep and goat. And hypotension, weak and rapid pulse, and cardiovascular collapse with respiratory depression is also seen. And convulsions, coma, and death occurs only in severe poisoning, or else the death is not a near future. And diagnosis is by administration of methacholine 5 mg neostigmine or 1 mg subcutaneous phase to induce topical muscarinic effect. And the treatment of the poison especially has been ingested gastric lavage should be done with tannic acid, like, and also camphor is ineffective in oxidizing the atropine. And the patient should be kept in a dark, quiet room. Cold spanning ice bags are applied to reduce the body temperature. And because it is going to cause the atropine fever, and the physostigmine 1 to 3 mg subcutaneous IV antagonize both central and peripheral effects, but has been found to produce hypotension and arrhythmias because it's going to act on the heart. As such, its utility is controversial. Neostigmine does not antagonize the central effect, and other general measures, especially the maintenance of blood volume, assisted respiration, diazepam to control the convulsions, and appropriate steps to measure all the dehydration, etc., need to be taken. And the contraindications are the atropinic drugs are absolutely contraindicated in individual with narrow, that's iridocorneal angle, and may precipitate acute congestive glaucoma. So, however, marked rise in the intraocular tension is rare in case of patients with wide angle glaucoma. So, the caution is advocated in elderly males and prostatic tumors, as already it is told. And the drug interaction are many, like the levodopa, it should not be administered. On the other hand, the digoxin and tetracycline absorption may be increased due to longer transit time of the GIT. And antacids interfere with the absorption of the atropine and the anticholinergic drugs. Antihistaminics, tricyclic antihistamines, phenothiazines, etc. They have the anticholinergic property, and additive side effects occur with atropinic drugs. And monoamine oxidase inhibitors the metabolism of anticholinergic and anti-Parkinson disease, and delirium may also occur. So tomorrow we will deal with the drugs acting on autonomic ganglia and further steps.